This is a story for when a lot of US Americans believe that the European health system is so amazing. Well, I'm in Austria right now. It's actually my home country. And this is a story to tell you that it's not. At least it's not what it used to be when I grew up here in Austria. So I essentially need to get something checked out, right? And I need to see a specific doctor, like a gynecologist. And I'm calling up, mind you, about, and I kid you not, 27 doctors, at least, the better rated ones. We're talking 5 out of 5, 4 out of 5, 3.5 out of 5 at least still. So not like I'm trying to skip the 1 and 2 star rated ones. And I'm calling up so many gynecologists, and every single office is telling me that they're not accepting new patients. I have to go see someone else. So they're not accepting new patients. And I'm like, what the F am I supposed to do? Do you see what I'm saying? Because I even of course offered like to pay them just out of pocket private. I'm not even going for the public health insurance, which I heard from my friends. You have to wait even for months and months and months to get an appointment. And the sheer situation that there seems to be not a lot of doctors, and I had the same situation also happen when I needed to see an HNO for my older son. Do you know it? You have to fight for an appointment. And then when I talked to my friend who was going through breast cancer in the US, one thing that you can do that they do well in the US is they're making sure to pre-screen you really well. And I feel like here in Europe oftentimes, but of course by and large, I heard the mortality rate is higher of different illnesses and ailments in the US, because you also have more people, and because I think they track it earlier. And here in Europe, sometimes when you have any kind of out of ordinary situations, do you know what I mean? It's a fight. And especially when it comes to the public health system, if you don't have a private health system on top of that, there's like a hierarchy to it. So say that happened to my dad as well. Say he paid into the system his whole life and had to get something done, right, a surgery. And what they do is they're using the cheaper material. Say, for instance, you need to get a hip replacement or anything like that, right? They're using cheaper material on you or in you. They're using less experienced doctors than if you had private insurance. So such a hierarchy when it comes to health insurances. And I was wondering how it is in your country.